While you're reading this, someone in the world dies from a blood clot every 37 seconds. That's exactly how long it took you to read this sentence, and the worst part is that most of these deaths could have been prevented. There's a vitamin you probably already have at home right now that science recognizes as one of the greatest allies for your circulation, yet almost no one explains it properly. Hello, I'm Dr. Rafael Borges. After years of seeing patients who came to my office with heavy, swollen legs, varicose veins, nighttime cramps, or even a diagnosis of thrombosis, I learned one important thing. Quality information really does save lives. And that's exactly what I came here to share with you today. But first, I need to be honest. The title of this video talks about getting rid of blood clots, and I have to clarify this responsibly because my commitment is to medical truth, not sensationalism. No vitamin in the world can dissolve a clot that has already formed inside a vein. That requires specific medications, given in a hospital setting under medical supervision. Anyone who tells you otherwise is misleading you, and that's dangerous. What this vitamin does, and does very well, backed by serious studies, is create an environment inside your body where it becomes much harder for clots to form in the first place. It protects, prevents, and helps keep your blood flowing in a healthy way. And that, my friend, can be the difference between staying well or facing a medical emergency. Stay with me until the end, because besides revealing which vitamin this is, I'm going to show you how to add it to your daily routine in a simple and safe way. Let's go together. Before we talk about the solution, it's important that you understand the problem. When you understand what's happening inside your veins, everything makes more sense. Think of your body as a big, busy city. Your veins and arteries are the roads and highways of that city. Blood is the traffic, carrying oxygen and nutrients to every cell. Arteries carry oxygen-rich blood away from the heart to the rest of the body. Veins bring it back. Here's the critical part. The veins in your legs have a tough job. They have to push blood upward, against gravity, from your feet all the way to your heart. To do this, they rely on valves that work like little doors. They open to let blood pass and close to stop it from flowing backward. When these valves are working well, the flow is perfect. But over time, with a sedentary lifestyle, excess weight, or simply aging, they weaken. Blood starts to pool and stagnate in the legs, and stagnant blood can clot. This is how deep vein thrombosis usually begins, almost always in the legs. According to the Brazilian Society of Angiology and Vascular Surgery, more than 425,000 Brazilians were hospitalized for thrombosis treatment in just 1 decade, an average of over 113 hospitalizations per day in the public system alone, and 92% of those were emergency cases. The condition is underestimated because it often gives no warning before it becomes serious. The clot itself is already dangerous, but the real threat comes when a piece breaks off, travels through the bloodstream, and gets lodged in the lungs. This is a pulmonary embolism, one of the leading causes of preventable death worldwide. According to the World Health Organization, someone dies from clot-related complications every 37 seconds. The International Society on Thrombosis and Hemostasis reports that 1 in every 4 people who develop deep vein thrombosis will die because of it. The risk increases significantly with age. Between 70 and 79 years old, the incidence reaches 500 cases per 100,000 people per year, 5 times higher than in younger people. If you're 50, 60, 70 or older, or if you live with someone in that age group, this is something you need to know. But now let's talk about what you can actually do. It all starts with paying attention to what your own body is trying to tell you. There are clear signs that the circulation in your legs isn't working well. Most people dismiss them as normal tiredness, but they're not. They're warning signals. The first sign is that feeling of heaviness in the legs, different from regular end-of-day fatigue. It feels like you're carrying extra weight in your feet, especially in the afternoon. The only thing that brings relief is lying down and elevating your legs. This happens because pooled blood and fluid buildup in the tissues make your legs literally heavier. The second sign is swelling in the feet and ankles. That deep mark from your socks elastic at the end of the day, or shoes that suddenly feel tight by evening. This is edema, caused by increased pressure inside the veins. At first it comes and goes, but over time it can become constant. The third sign is nighttime cramps. That sharp pain in the calf that suddenly wakes you up in the middle of the night. It's a classic sign that your muscles aren't getting enough blood and that metabolic waste is building up. The fourth sign shows up on the skin of your legs, feet that always feel cold, skin that turns pale or bluish, dark or reddish spots near the ankles, or dry, itchy skin without any obvious reason. The skin on your legs tells a story. Learn to read it. The fifth sign is tingling, or that pins and needles feeling, as if your leg has fallen asleep. When blood flow is poor, the nerves also suffer and complain in this way. And the sixth and most visible sign is varicose veins and spider veins. Those bluish or purple veins that appear on the surface of the skin show that the valves aren't working properly and blood is pooling. This isn't just a cosmetic issue. It's a sign that your circulation needs attention. If you recognized yourself in any of these signs, don't panic. Take action. And the first step starts with your diet. But before we continue, if this information is making sense to you and you think it could help someone you care about, hit the like button now and subscribe to the channel. It helps get this information to more people who need it. And tell me in the comments which state you're watching from. I love knowing where my viewers are from. Now let's talk about the main star of this video. The vitamin I call the protective shield for your veins. I'm talking about vitamin E. But I'm going to be very specific about what it does and what it doesn't do, because the health of the people watching me is my responsibility. A study published in the journal Thrombosis Research showed that vitamin E has the ability to inhibit platelets, the cells responsible for starting the clotting process. In other words, it acts as a natural anticoagulant, reducing the blood's tendency to form clots where it shouldn't. Vascular surgery specialists from the Brazilian Society of Angiology explain that, thanks to its antioxidant and antithrombotic properties, vitamin E prevents platelet aggregation inside blood vessels, lowering the formation of clots. It works on three fronts at the same time. The first is protecting the vein walls. Inside the body there are unstable molecules called free radicals. They come from pollution, stress, and normal metabolism. They attack and damage the inner lining of blood vessels. When a vein wall gets damaged, it becomes rough and inflamed, attracting platelets like a magnet and creating the perfect environment for a clot to form. Vitamin E is a powerful antioxidant. It positions itself in the cell membranes of the blood vessels and acts like a bodyguard, neutralizing free radicals before they can cause damage. With smooth, healthy vein walls, blood flows without obstruction. I remember one of my patients, Mr. Antonio, a 73-year-old retiree. He had spent decades sitting behind a desk. When he came to my office, he had dark spots near his ankles, something called ochre dermatitis, and woke up every night with cramps. His diet had almost no vitamin E, fried eggs, meat, white bread, and soda. After we adjusted his eating habits and got him moving, his symptoms improved significantly within a few months. He told me it was the first time in years he had slept through the night without waking up in pain. The second front is the anti-aggregant effect, the most direct way it helps prevent clots. Platelets normally circulate calmly. When they detect a damaged wall, they become sticky and clump together to seal the area. This is normal and necessary when you cut yourself. The problem is when this process activates without reason inside a healthy vein. Vitamin E acts like a thin protective layer over the platelets, reducing their tendency to stick together when they shouldn't. It's as if it gives them a non-stick coating. This doesn't stop clotting when it's truly needed, but it significantly lowers the risk of spontaneous clots forming inside vessels. The third front is vasodilation. Vitamin E stimulates the production of substances that help blood vessels relax and widen slightly. When vessels are wider, blood flows with less effort, pressure drops, and the risk of blockage decreases. It's the difference between driving on a narrow, potholed street versus a wide, well-maintained avenue. I also have another patient, Mrs. Maria, a 67-year-old retired seamstress from the interior of São Paulo. She came in because her daughter insisted. She had varicose veins for years and was constantly taking pain medication. She was overweight, didn't exercise, and her diet was mostly fried and processed foods. Her tests showed vitamin E levels well below ideal. I explained that I wasn't going to give her any magic recipe, but that I would show her how her body could work better with the right nutrients. We added sunflower seeds to her breakfast, olive oil to her meals, and spinach for dinner. We combined this with short 10-minute walks every day. After some time, she told me, "Doctor, it feels like something changed inside. My legs feel lighter. Here's something I need you to pay close attention to. High-dose vitamin E supplements should not be taken without medical supervision. The same property that makes it beneficial, its anticoagulant effect, can become risky in high doses. It may increase the chance of bleeding, especially in people who already take blood thinners like warfarin or even aspirin. If you have scheduled surgery, you need to stop taking vitamin E supplements at least 2 weeks beforehand. Always talk to your doctor before starting any supplementation. This rule has no exceptions. The safest, most effective, and most enjoyable way to get vitamin E is through food. Nature has been very generous here. The top food is sunflower seeds. Just a quarter cup of toasted sunflower seeds gives you almost all the vitamin E you need for the day. You can sprinkle them on yogurt, salad, or oatmeal, or eat them as a snack. They're cheap, easy to find, and tasty. Second are almonds. A small handful of about 20 almonds already makes a difference. Eat them as a mid-morning snack. Besides vitamin E, they also provide magnesium, which helps relax blood vessels. Third is extra virgin olive oil, cold-pressed. Heat destroys vitamin E. Use it on salads, cooked vegetables, or bread. Don't use it for high-temperature frying, or you'll lose the benefit. Fourth is spinach. Steamed or lightly sautéed, it releases even more of its nutrients. It's rich in vitamin E, vitamin K, magnesium, and iron. A serving a few times a week makes a big difference. Fifth is avocado. Many people avoid it because of the fat, but it's exactly the kind of fat that's good for your heart. It's rich in vitamin E and potassium, which helps control blood pressure. Sixth are fatty fish like salmon, sardines, and tuna. Besides containing vitamin E, they're the best sources of omega-3, a powerful natural anti-inflammatory. The combination of vitamin E and omega-3 is one of the best natural things you can do for vein health. A breakfast with yogurt and sunflower seeds, a lunch salad with olive oil and spinach, and dinner with sardines or tuna, plus a piece of avocado. This isn't a diet. It's preventive medicine on your plate. Vitamin E doesn't work alone. It has allies that multiply its effects. Omega-3, found in fatty fish, chia seeds, and flax seeds, is an anti-inflammatory that reduces blood viscosity, making it more fluid. Studies show that populations with high omega-3 intake have significantly lower rates of cardiovascular disease and thrombosis. Vitamin C is the perfect partner for vitamin E. It helps produce collagen, the protein that gives strength and elasticity to vein walls. It also recycles vitamin E after it uses its energy-fighting free radicals. One doesn't work well without the other. Oranges, acerola, lemon, strawberries, kiwi, and red bell peppers are your daily allies. Flavonoids, found in red fruits like blueberries, blackberries, strawberries, and raspberries, strengthen capillary walls and reduce inflammation. They act as structural reinforcement for your veins. And I can't forget hydration. Blood is mostly water. When you're dehydrated, blood becomes thicker and circulation worsens significantly. Drinking water consistently throughout the day is just as important as any vitamin. However, the most important thing of all is this: no vitamin, no food, and no supplement can replace movement. The biggest enemy of circulation is staying still. When you walk, the calf muscles contract and squeeze the veins in your legs, pushing blood back toward the heart. That's why specialists call the calves the second heart. Every step you take acts like a pump that activates circulation. 30 minutes of walking per day already makes a difference. It doesn't have to be all at once. It can be 10 minutes, 3 times a day. If even that's difficult, while sitting you can move your feet up and down, make circles with your ankles, or do heel raises. These simple movements activate the muscle pump. At the end of the day, lie down and elevate your legs above heart level for 15 minutes. Let gravity help drain the pooled blood. Control your weight, because excess weight increases pressure on the leg veins. Avoid clothes that tightly compress your waist or groin area, and avoid staying in the same position for long periods, whether sitting or standing. I want to summarize what we covered today so you leave with a clear plan. First, vitamin E is the shield for your veins. It protects vessel walls from free radical damage, reduces the tendency of platelets to clump together inappropriately, and helps blood vessels relax and dilate. Scientific studies confirm its role in preventing clot formation. Second, the best food sources are sunflower seeds, almonds, extra virgin olive oil, spinach, avocado, and fatty fish. Try to include at least 3 of these options in your daily routine starting today. Third, vitamin E has powerful allies: omega-3, vitamin C, flavonoids from red fruits, and proper hydration all multiply its benefits. Fourth, high-dose vitamin E supplements carry real risks and require medical supervision. Food remains the safest path. Fifth, and most important, if you have heavy legs, frequent swelling, nighttime cramps, skin changes on your legs, or a family history of varicose veins or thrombosis, schedule an appointment with your doctor. Don't replace a medical consultation with a YouTube video, not even this one. Before I go, I want to tell you something. What hurts me most as a doctor isn't when a patient arrives with a serious diagnosis. It's when they say, "I've been feeling these symptoms for years, but I thought it was just normal for my age." It's not normal. And you don't have to accept living with heavy, swollen, and painful legs, thinking there's nothing you can do. You have the power to change your health. It starts with what you put on your plate, and with the decision to move every day, even if it's just a little. If this video opened your eyes, share it with someone you love. That family member who always complains about nighttime cramps, that friend who constantly has swollen legs. Sharing this information is a real act of care. In the next video, I'm going to reveal the 5 daily habits that are silently destroying the circulation in your legs, and one of them will probably surprise you because it seems completely harmless. You won't want to miss it. I'm Dr. Rafael Borges, and my mission is to give you quality information so you can live longer, live better, and live healthier. Take care of your legs. They carry you through your entire life. See you in the next video.